Good morning. We're here in beautiful Costa Rica next to the Courtyard by Marriott, and we're going on our second treatment. I'm here with my good buddy, Dr. John Ballas at Infinity Regenerative Medicine. That's going to be good. So beautiful modern facility, very, very advanced, very modern, very, very clean. We have 3 different treatment rooms, and then we have 2 more IV rooms. So if you come with your husband and your wife, or you come as a couple, you guys can both get treated at the same time. The lab, of course, is next door to the clinic where they make the fresh cells that they were finishing up in the lab this morning and just brought in, literally 10 minutes before I got here.
Our stem cells are sourced exclusively from the umbilical cord from natural births with 0 complication. Our donor selection is meticulously managed with health assessments conducted to verify the donors are eligible. Every single sample is carefully screened, tested, and verified to uphold the highest quality standards. This is not just about maintaining quality, it's about ensuring your safety and optimizing the effectiveness of your treatment. We maintain a strict chain of command with minimal personnel involvement. Fewer hands, less risk. Every stage of collection, processing, and application is managed by a select group of highly trained professionals. This means complete accountability from start to finish. You know exactly what you're getting, where it came from, and how it was handled.
200 million IV intravenous into my body, and again, it will go through the body, find any areas of inflammation, damage, and start the repair process. And there's an anti-aging benefit, there's an immune modulation benefit, there might be some unknown benefits that we're learning over the years as well. Last year, about 6 weeks into the treatment, I just felt a completely different recovery.
Regenerative tissues use the technology your body has used your whole life to grow, repair, replace damaged tissue. When we are born, we have the biggest concentration of these things needed to do this. By the time we have grown, normally in our late teens or early 20s, we have used 90% of our supply. We live on the other 10% for the rest of our life. We continue using up our supply whenever we have an injury, a cut, or a bruise. For some people, the supply gets so low the body just can't keep up. The regenerative tissue we inject into your area of pain or problem concentrates on what you need to fix the problem. It helps your body to have the tools to fix, repair, or replace the damaged area.
I'm here with Dr. Fournier, and Doc's going to inject 100 million cells into my L5 disc region. So we're going to show you that procedure.
Compression right now, just the pressure.
So let me briefly tell you my stem cell journey. It all started with my 14-year-old son, who's now 19, about 5 years ago. He gets sick with an autoimmune ulcerative colitis, which is a very horrible disease. I won't get into the details. But it affected his growth, it affected his health. He couldn't put on any weight, he was sick all the time. And he got an 80 million count IV over 4 days, and 6 weeks later, I had a new son. And he was basically in remission for about 3 years. So that's how my introduction to stem cells, a very personal journey. I want to give you some more information about how the cells are processed. The cords come from young, healthy mothers that are already pre-screened and has very detailed parameters. History, examination, blood work, STDs, everything you can think of to make sure that the cord is healthier. The healthier the mother, the healthier the cord, the healthier the cells, the more potent those cells are going to be, the more benefit that you're going to get. Then within 2 hours, that cord is back in the lab, not frozen, where they start the processing of getting the cells and harvesting the cells from the cord and processing the cells.
I take care of the whole process related with the cell production. Frequently, we check for microbiology, like bacteria, fungus, and toxins. We also check for the karyotype, just to be sure that the cells have no chromosomical disorders. We check for like identity. This is like using flow cytometry. We basically scan the cells using some special markers to be sure that the cells that we are working with are actually mesenchymal stem cells in the right concentrations, right? So once we have the microbiology, the identity test, the karyotype, and all the controls are good, and we have the right quantities, then we harvest the cells the same day you're gonna get treated. Once we have the cells in a pool, we use a cell counter to know the quantity, the number of the cells to prepare the treatment. We also do the viability, which is the number of cells that are alive, because we want you to have like alive cells in your body, not dead cells. And we also check for the size.
When you come here, they're wonderful. They will expedite your trip, pick you up at the airport, bring you to the office. Customs in Costa Rica is easy, efficient. The staff here is wonderful. The communication with the staff is easy. And this is in a beautiful area, and there's restaurants, there's shopping, there's great food, there's things to do if you choose to stay a few days. There's excursions if you want to go out and do some touring. So you're not limited with the treatment. You're not stuck in a hospital. You're not stuck in a hotel room. We have several options. You don't have to make a vacation or a trip. It's a beautiful place. For more information, please contact Evan Ozasa at 360-878-3335.